initiatives to minimize damage from risky behaviors without requiring people to quit immediately or completely. If, for example, if we're trying to drive, mag-drive tayo, and we do not use seatbelts, this can cause harm. Kung magkakaroon tayo ng sudden accident, it's going to cause harm. That's the reason why somehow when we explain to our patients, how harm reduction is, it's simply put na parang you wearing a seatbelt is actually a form of harm reduction. And this is very classic example natin whenever we talk about harm reduction. Diba? Sa mga hindi nanigarilyo, when they see a person who is smoking, ang dali sabihin, hey, ang dali lang, huwag quit ka, ang dali lang yan. But we have to meet where they are. Yung mga pasyenteng nahihirapan talagang mag-quit. Because quitting is really difficult for most patients. So the core message is, if we cannot eliminate the use, we can at least reduce the harm. So when we now talk about tobacco harm reduction, we adapt the Swedish model for cigarette smoke elimination. So first is policy framework, regulate, not ban, non-combustible nicotine products, implement tiered excise taxes, adapt risk-based labeling to inform the public. Example, 90% less harmful alternatives than smoking. Launch national smoke-free. Our government should have this really good policy on looking forward for a nation-free, smoke-free nation, and align with UH with all of these policies.
More than the population of Philippines. Imagine for a second the entire population of Philippines, more than that, dying every year. That's perspective, right?
120 million.
You have less people in Philippines, we have more people dying from tobacco.
We have 120 million.
Yes, you have 120, but we have only have 120 million, sorry, I was looking at the number above. 267 million total tobacco users, which is more than the population, and 1.35 million annual deaths which are happening every year.
Live smoke-free because they are empowered with better choices instead of continuing to smoke harmful cigarettes. We believe that paving the path to a smoke-free Philippines must be grounded in truth, science, and compassion, with these as our building blocks to the future we seek. To include in our consumer rights the access to accurate, science-based information and less harmful alternatives to combustible tobacco. To recognize that tobacco harm reduction is a lifeline, especially for adult smokers who do not quit. To provide consumer voices, particularly those who have successfully transitioned to smoke-free products, meaningful representation in policymaking. To reconsider bans and excessive regulation of smoke-free alternatives that risk doing more harm than good, potentially driving people back to smoking or into unregulated markets. To take a multi-sectoral approach, engaging public health experts, scientists, consumers, and industry stakeholders, which is essential to crafting effective, compassionate, and evidence-based policies. To assert our national sovereignty by defending our vape law, RA 11900, on the global stage, which recognizes tobacco harm reduction as a public health strategy.
Taas mo yan, kuya. Taas mo. Ka-level niya.
Mag-1, 2, 3 po. Sa zero po natin. Ito ang boses ko. So, 1, 2, 3.
Ito ang boses ko. Isa pa, para hindi malakas. 3, 2, 1. Ito ang boses ko.
Okay. Isa pa.
Alright.